thank Mayor Pro Tem Martin and Councilmember Pollard for being with me today. We also have Dr. Peirce, the Chief Medical Officer for the City of Houston, Dr. Lauren Hopkins, who is here, City of Houston Health Department, Dr. Sameski from Baylor College of Medicine, who is also present, and then Director Williams Director Stephen Williams with City of Houston Health Department is also present. I wanted to start off today with an important update about the City of Houston's Direct Assistance Program. The city of, and this is the program in which we're providing $1,200 to families in the City of Houston with the CARES funding. The City of Houston's partner, Baker Ripley, met our deadline to send out the first batch of direct assistance checks to families and individuals who have been affected by the coronavirus pandemic and need financial assistance. Last Friday, 2,355 checks were mailed, each one of these checks in the amount of $1,200 for a total amount of $2,826,000 distributed of the initial $10 million in that first batch. Of that, 2,085 recipients were from the Harris County Direct Assistance waiting list and 270 from the City of Houston's Utility Assistance waiting list. Today, another $2.5 million will be sent out to individuals as well. They represent City of Houston recipients who applied to the Harris County program but did not get assistance because the money ran out. Baker Ripley will continue to review applications through December 30th until all funds are paid out, and they're working with a list of about 50,000 individuals who have applied through various programs. The assistance program is funded through the city's portion of the CARES Act, and the money is getting to the individuals who need it most during the pandemic, and it's our goal to get as much of that out, these $1,200 checks, prior to Christmas, or certainly all of it will be distributed this month. It also points out to the need for additional assistance from Congress, and so we are hoping that they will be able to resolve their differences and provide additional assistance to many, many families throughout the country who need their help. Now to our daily COVID-19 update. Today, the Houston Health Department reports 745 cases of COVID-19, bringing the Houston's total to 1,004,962. Again, that's 745 new cases being reported today. There are 6 newly reported deaths, persons who have died as a result of COVID-19, bringing the city's total to 1,493. That is 6. And then, as you can see, you can look up on the board there, which means that this virus is still having a daily impact on Houstonians. So let us never forget that each number represents someone's loved one who has died of this insidious virus. The positivity rate is also up for this week in the City of Houston. It is now 10.5% compared to 8.8% last week. So the positivity rate is up. However, I will say that, Dr. Peirce, when I looked at the daily numbers this morning from TMC, all the hospitals, the reproduction rate was down. It was now under 1. And when it's under 1, that indicates that the virus is slowing down. And so we just have to continue to look at it week by week to kind of see. So that's the good news. And then today, the number of people in our hospitals were right at 1,200, which was kind of roughly half of the numbers that we saw during the summer. And then in terms of the ICU, we are still operating, as of today, in that first phase. We're not in surge capacity, but close. So again, it's just a reminder for everyone to continue to mask up, to engage in social distancing, to exercise, clean your hands, sanitizers. We need to continue to do that, even with the vaccine on its way. So even with all of the hope and the anticipation and the vaccine will have on this virus, we must continue to do our part. Now, The Houston Health Department's response to the COVID-19 pandemic has been nothing short of extraordinary. And so I certainly want to acknowledge Director Williams for his hard work and his staff, Dr. Hopkins and their staff, all of the work that's been done by the City of Houston Health Department. From a nationally recognized testing strategy focused on access and equity to robust contact tracing to ample human service support, the health HHD is a national model. Another reason HHD stands above is innovative strategies to understand the impact of this virus on our community. You may recall the wastewater testing project that helps precisely target life-saving interventions. Today, we will outline the results of the department's antibody testing survey, a partnership between the Houston Health Department, Baylor College of Medicine, and Rice University. I want to acknowledge representatives who are here in the room. This survey, conducted in September, provides us more information to inform our battle against this deadly virus. And here to announce the results is Houston Health Department Chief Environmental Science Officer, Dr. Lauren Hopkins. Dr. Hopkins.
Thank you, Mayor. This survey is a partnership between the Houston Health Department, Baylor College of Medicine, and Rice University. So most people tend to get tested for COVID-19 if they have symptoms, but as many as 40% of people who are infected don't get symptoms. That means testing data does not give us a complete picture of how many people were infected in our city. But people who were previously infected with a virus that caused COVID-19 have antibodies in their blood, regardless if they have symptoms. This study estimates how many Houstonians have already been infected with COVID-19 by September by testing their blood for antibodies. Phase 1 took place September 8th through the 19th. The Houston Health Department partnered with the Houston Fire Department to visit 420 randomly selected Houston homes. Participation was really amazing, with a total of 678 people volunteering to give blood samples for this effort. Our results show that an estimated 13.5% of Houstonians, which is approximately 250,000 people, had been infected with COVID-19 by September. The estimated number of people with antibodies for COVID-19 is approximately 4 times the number of reported PCR cases in the health department database in September 2020. That means 4 times more people had the virus than was previously known. High positivity rate areas had more people with antibodies than lower rate areas. More women than men had antibodies. The prevalence of COVID-19 antibodies was higher among Hispanic and non-Hispanic Black residents as compared to other racial groups. The prevalence of COVID-19 antibodies was higher among younger people as compared to people 40 years and older. So what's next? The second phase of the study is planned for January 2021. It's 2 phases, or 2-pronged. People who tested positive for COVID-19 antibodies will be asked if they'd like to be retested, and that is to measure the amount of antibodies they have 4 months later that we found in September. Researchers will randomly select another 420 households in low and high positivity rate areas, and again ask for volunteers to give blood samples so we can get another snapshot of what the prevalence rate is across the city. So the second phase will measure how much the virus has spread since phase 1, and also how antibodies decrease over time.
We'll certainly come back to questions to Dr. Hopkins. Fascinating survey, which reflects that the virus was probably prevalent in our community 4 times the reported numbers that we have, which also underscored the importance of wearing these masks and the social distancing. So that's important information to have, and thank you, Dr. Hopkins. Today marks also an important milestone in our efforts to slow the spread of COVID-19 in our community. Since March, for 9 long months, we have battled the global pandemic. This morning, the first COVID-19 vaccine shipments arrived at 4 hospitals around Texas, including the MD Anderson Cancer Center in the Texas Medical Center. I want to certainly be clear that even with this important steps and with approval by the FDA of the Pfizer vaccine, we still need to do our part to fight this virus. We are still in the midst of a pandemic, and every precaution must be taken to slow the spread and save lives. It is great news that the Texas Department of Health and Human Services announced that tomorrow more of the vaccine will arrive in Houston, specifically at Texas Children's Hospital, Maine, LBJ Hospital, St. Luke's Health, Memorial Hermann Texas Medical Center, and Houston Methodist Hospital. We know that frontline healthcare workers and residents of long-term care facilities are the first group to be vaccinated. They are on the front line, so that's quite understandable, and the vaccine is voluntary, and it will likely be months before anyone who wants it can get it, but the process is starting. And so let me encourage our hospitals, those who are going to be getting it, especially those who are getting it now, the MD Anderson, the other hospitals at the Texas Medical Center, to start putting those vaccines to use as quickly as possible. I certainly would love to see them do it, Dr. Purse, just on the very same day that they get them. Just to point to the urgency of it, let me also encourage them to make it the utilization more transparent, more available, so people can see our healthcare workers, many of them, some of them taking it, when so many people in the general community are hesitant to take it. I think it's important for them to see our healthcare providers and people in our Texas Medical Center and our hospitals taking it. So let me encourage them to start those vaccinations as quickly as possible, like yesterday. So quite frankly, if you're getting it today, I would love for you to do it today. If you're getting it tomorrow, I would love for you to start the process tomorrow. And then I think it's important to provide access to the media when some of them are getting the vaccine, because it's important for the people in the community, in these communities throughout the city of Houston, from Kingwood to Clear Lake to Fort Bend to Denver Harbor to Fifth Ward to Acres Home, to see our healthcare workers actually taking the vaccine. I think it would create more confidence and make people feel better to see it. So let's not keep it behind the walls of the hospitals. Let's kind of make it available. It was good to see Governor Cuomo, for example, this morning, and making it available for people to see the first person in New York getting that vaccine. I thought that was very positive. Let me encourage the city, the largest medical center in the world. Let's be on the front end. Let's make it visible, transparent, because it is important for people to have the greatest degree of confidence that this vaccine is safe, reliable, effective, and we want as many people to get it as possible. I intend, as soon as my name is called on the roll, whenever that is, I intend to get it, to take it, and to take it in a very public fashion. Now, having said that, let me turn to Dr. Purse.
Thank you, Mayor. And yes, the virus is still here, but so now is the vaccine. And so we need to get moving on the vaccine. We need to get it out. We need to get it into people's arms. We need to demonstrate to people that they can feel confident with this vaccine. So the vaccine is new. Its technology is new. There's been a lot of attention in making sure that it is developed in a safe way. And one of the things we hear, people are concerned that it was developed very quickly. And yes, it was developed quickly in less than a year, but the technology behind this new vaccine actually goes back to 15 years ago when we first dealt with SARS-1. So there's nothing really new about the technology. It was all set up, ready to go, had been tested, had been proven in other vaccine trials with SARS-1. But SARS-1 went away. So there was no reason for mass vaccination back then. But all that infrastructure was in place. All we needed was the genetic code for this new virus in order to get things going. So On one hand, there's an appearance that it came up quick, and it did, but all the backbone, all the industry, all that stuff already existed. So there's nothing from a scientific standpoint, there's nothing that was rushed in this. So the vaccine is very safe. So as soon as we get vaccine and we can start getting it into people, then people will see that the side effects are what have been advertised, which is that they're, for the most part, they're pretty mild. They're like you would get with any other vaccine. People can expect to have a sore shoulder, a little muscle ache, a little bit of fever for a day or so, probably easily treated with a little Tylenol or a non-steroidal like Motrin or something like that, and move on. A lot of information has come out about the two healthcare workers in the UK that had some serious reactions. What has also come out is that those two healthcare workers had serious reactions to previous vaccines. And so one of the things that we've come to learn as we look at it is that they actually had allergic reactions to previous vaccines. And what we now know is that if you've got allergies to other things like peanuts or shellfish or to latex or something like that, those are not reasons to be worried. You really only need to be concerned if you had a reaction to a previous injected medicine or vaccine. So let's get those vaccines out and get them going. And then the other thing I just want to comment on is the prevalence study shows that the amount of people that have been infected in Houston is 4 times what we thought it was. So to the point that the mayor made and that Dr. Hopkins made was that, the virus will continue to spread because of its nefarious nature. With so many people being asymptomatic, it is the sneakiest of viruses. And it is out there. It is in the community. Now, yes, the R value dropped down to just under 1 today, but you can see that our positivity rate went up, and there's usually a little bit of a lag there. But nevertheless, 10%, and you'll also notice from that slide that a lot of people are getting tested now. So we have great confidence that 10.5% is very accurate. So there's a lot of viral activity going on right now. So the vaccine is the great news is coming out. This prevalence study is giving us tremendous insight into what has already happened. We need to pay attention to what it teaches us. We need to remain diligent. Well, the good news is that the vaccine is here. Absolutely not a reason to drop our guard. Remember, we as a community drove this virus down. I want to say away, but we drove it down in August because of how we changed our behavior. We can do that again. Right now, it's got the upper hand. It is sneakily creeping up. And the virus is on the horizon, or the vaccine is on the horizon, but do not drop your guard. Keep your fists up. Fight this virus. Beat it back down to where it belongs.
Thanks, Dr. Purse. Get tested. Keep these masks on. Wash your hands. All of those things we need to do, even with the vaccine being here in the city of Houston, and it will be taken in phases, some this month, then January, February, March, April, until everybody has access to it. So that's what we want to emphasize. At this point, we'll have questions to Dr. Hopkins with respect to the antibody survey, Dr. Purse or Stephen Williams or anyone else.
Okay, this could be addressed either by you, Mayor, or Dr. Purse. The agenda had the City Council looking at the Bayou Event Center as a inoculation location. Is this something that the logistics are starting to be kind of planned out about?
In fact, that calls for for Director Williams.
Actually, what you're referring to is we did a model drive-through vaccination where we sent, I think it was around over 300 of our employees through just to get the logistics and the layout to see exactly what we would do if we had to engage in drive-through vaccinations for COVID. It was interesting because the day was rainy and we were still able to get several hundred people through there. That's why we re-rented that facility. We had, I think it was about 14 drive-through lanes.
So does that mean that this was kind of like a logistic kind of testing out the possibility of that at location?
Yes.
Does it mean that there's a plan to use that facility in a mass inoculation program at this point?
We haven't decided exactly where that would occur, but that is a possibility, but it hasn't been determined. What we will have to do is to monitor the uptake in vaccines, see exactly who's getting vaccinated, where they're getting vaccinated. Part of our plan actually involves ensuring that vulnerable populations will get the vaccine. And so therefore, we're going to use a model very similar to the model that we use for testing. We use mobile teams to go into various neighborhoods. The thing that's also different about this vaccine distribution is that you're going to have hundreds of providers in the community who have actually signed up. We have over 500 that have providers that have either signed up or are in the process of signing up. And so people could go to their physician's offices. They can go to CVS, Kroger, Walgreens, anywhere where there is a pharmacy to get COVID vaccinations.
So City Health Department location, City Health Department clinics or county clinics, would those also be incorporated into a big plan?
Yes, we plan as a health department to really exercise our role as a safety net provider. Oftentimes, we do have immunization clinics in several of our health centers, and so we will also mimic that model with COVID. Those health centers and community centers are actually, multi-service centers, are actually located in very strategic locations, and so therefore that is a possibility for us.
Okay, I have an additional question.
And if I can just amplify a little bit more on that. What we found is that during the testing phase, you had let's say X number that when it got tested, and then all of a sudden it was X plus Y. And then we were building up the infrastructure to take care of that, building up capacity. We are anticipating people may be hesitant right now, but I think as they witness other people taking it, seeing the minimum side effects, if any, then more people will want to be vaccinated as we move forward. So we want to make sure that we work to build that capacity on the front end rather than waiting and having to respond after the fact.
Okay, Mayor, the White House COVID Task Force had issued a message to Texas that Texas needed to do more to limit the spread of COVID. Is that something that obviously I guess it was a couple weeks ago or so you were talking about the possibility of a curfew? Is there anything going on here within your domain that's responsive to this urging from the COVID task force?
I think that was more of a message to the governor, not necessarily to the local officials.
But I mean, as a local official, is that weigh in on any decisions or considerations you're making at this point?
Well, I will tell you that in terms of any events that are city permitted, produced, authorized, we are holding on all of that. So there are no parades, for example, that are taking place in the city of Houston. We've minimized any large gatherings that are taking place in the city. Our employees, for example, are still operating remotely in many cases. I've just extended that through the month of January. So we are doing that. We are monitoring the numbers, looking at the numbers every single day to see how quickly the number of cases are occurring and whether or not the only real option that we have left is, for example, to put in place some sort of potential curfew. We're monitoring the situation carefully, and I reserve the right to do that if need be. But all of the other tools that we had in March and April, those have been taken away by the governor, and so that directive was more aimed towards the governor, not necessarily to the local officials.
As far as the curfew, would you say that you're at the same position regarding a potential curfew as you were a couple of weeks ago, or are you maybe even a little closer to that option?
Well, we're looking at the numbers, the matrix as a whole. For example, like the R rate is down to today than it was, for example, last week. The number of hospital beds is now, I think it was like 1,201 this morning. During the summer, it was like 2,400. The ICU capacity last week was at 100%. Today it's at 99. So we'll continue to take a look at all of the matrix, and if it seems like all of the indicators are going up, and then that's certainly an option that I will consider utilizing. Quite frankly, it is already prepared and ready to go if I decide to move in that direction. So we'll just continue to look at the numbers. I continue to encourage people to do what has worked, we know has worked in the past, and that is to continue to keep on their masks and all the social distancing, wash your hands, All of those things they need to do. If you go into a place and it's crowded, turn around and step out. So don't do those type of things. But that too that we are talking about, that's like a nuclear option. It will hit the good players as well as the bad ones. And so if I go in that direction, then I certainly want to see the numbers all moving in the wrong direction. But right now, it's kind of mixed. Okay?
Okay, following up on your interpretation of the COVID task force recommendation as a message to the governor, are you in communication with the governor about any of these things, or is that pretty much been something that you're not pursuing because it doesn't seem to have much fruit?
Well, I haven't talked to him. I would probably, the media would probably have, be able to. Those are good questions, I think, that should be posed. But I can't speak for him, and I've not talked to him recently.
Okay, then the other, more of the medical question, the antibody count being very, showing 4 times the number of people tested on your estimation. Obviously, there's been a lot of talk about herd immunity and the level of which this prevalence of antibodies in the community. Is that anything that has any value in this mantra that you hear pretty regularly about achieving herd immunity?
Yeah, so that's a really good question. I'm glad you asked it. So we now know that in September, the number of people in the community that had been infected and had antibodies, which suggests that they had some level of protection against being reinfected, was at 13.5%. What the second part of this study is going to do, as Dr. Hopkins pointed out, is we're going to go back, we're going to test those people again and see what their antibody level is. Because if it's dropped off and some of those people have no antibodies left, that'll give us an idea as to how long the immunization lasts from natural infection. So herd immunity, we are estimating, based on experience with other viruses, that for this virus, we would need to have 70+% of the population to simultaneously be immune from infection, such that if the virus isn't, well, the virus will already be here, but it won't be able to spread. There won't be enough people to get infected to spread it to another folk or another person. So we think it's got to be about 70%. So we know that in September we're at 13.5. So in January, remember they're going to retest folks from before. We'll find out if they've maintained that immunity. There's also another 420 households which will be tested. So for that, we'll be able to find out if the 13.5% has gone up to or gone down, right? But it'll be really interesting to see. And then the other thing which the vaccine producers are doing is they're doing similar studies with some of the folks who get vaccinated to see how long their immunity lasts. Because if people become immune, but only for a short period of time, then our herd immunity is going to fluctuate with that. We've got to hit 70%. And so this is another reason why everybody needs to consider getting vaccinated, because if we only have a small percent of the population getting vaccinated, the virus is going to continue spreading. We have got to, if we want to stop wearing masks, if we want to have our businesses open, if we want to have the schools back to normal, we as a community, as a nation, as a global population, we have got to get to herd immunity. And so if that means my arm gets a little sore and I get a little fever for a couple of days, and so what? And if I have to do that once a year, so what? I don't know if I answered your question.
Okay, just to follow up on the study that you're about to do to see if there's a residual, to try to measure the residual antibodies. Is that, I haven't heard a lot about the science of how long people who've been exposed tend to continue to have some resistance to reinfection. Is this something that could be medically significant beyond Houston?
Oh, absolutely. Yes, absolutely. So there's 2 parts. One is we need to find out if folks still have antibodies. And then the other thing is that we want to learn, and this is what a lot of the research with the vaccine is going to do, is find out if that still gives you protection, right? So consider, with the Pfizer vaccine that came out and they said it's 95%, they had 95% efficacious. So what that meant was that they had 2 groups, people who got vaccine and people who didn't. They then followed them and they found out how many people got the disease. And 95% of the people who got the disease were the people who got the placebo, who did not get the vaccine. But 5% of the people who got vaccine still got ill. Much, much, much smaller number, but not 0, right? So that may be due to 1 of 2 things. Either their immune system didn't respond to the vaccine, which quite honestly is most likely, or it responded and it went away, its immunity was so short-lived that they wound up getting infected again before the study period was over. So those are the things that they're going to be looking at. So this study on a population of the fourth largest city in the nation is incredibly important to help answer the questions so the vaccine studies are very helpful, but it's within a study population. This study is looking at real-world population in the fourth largest city in the nation to get real-world answers.
And how soon do you think you'd actually be able to release the results of that thing if you're testing in January? Is it going to take a month?
That is a question definitely for Dr. Hopkins or Dr. Szymanski, but not for me.
So like, at what point would the public and the medical community get that kind of information?
Sure. I would expect it may take about 2 months after the longitudinal survey is conducted. Again, and this would allow for time for the analyses in the laboratory as well as for the evaluation of the data so that we can come up with the population-based estimates that Dr. Peirce just mentioned.
Okay.
Did we get everybody? Okay. Okay, we're good? All right. You want to talk to me in Spanish? We can talk on the side a little bit later on. All right. Ada, is there anything you want to encourage people in Spanish to continue to why don't you do it from here so I can hear whether or not you're doing it correctly?
Buenas tardes. Bueno, como tenemos las noticias de las vacunas que ahora están en el Texas Medical Center, que se están distribuyendo a nuestros trabajadores que trabajan en los hospitales, les pedimos que por favor sean pacientes y que sigan usando, ¿verdad? Sus máscaras, sigan practicando la distancia social y igual que no vayan a lugares donde haya mucha gente. Así es, pues mañana van a llegar a 4 hospitales más aquí en el área de Houston y le estamos pidiendo, ¿verdad?, a los trabajadores y a los hospitales que hagan demuestren que se están poniendo la vacuna, ¿verdad?, que lo hagan público para que la gente vea, ¿verdad?, y no tenga miedo de las vacunas. Es Ada Ortega, y secretaria de prensa. Gracias.